Well, welcome all. Thank you for joining us again this week. I'm going to keep my opening comments brief, as much of what I'm thinking about I think will come through in my conversation with tonight's guest. I do want to share that the interview that I had with Dr. Larry from Saturday is now available for viewing for those who missed it and for those who want to listen again. It was a tremendous conversation that I really, really enjoyed. You know it's powerful when YouTube removes it within a couple of hours, which is what's happened. But it's still available on Brighteon, BitChute, and some other platforms. Linda will post the links in the chat room so that you can take in Dr. Larry's conversation with us again. Our guest this evening is Jeremy Hammond. Jeremy is an independent journalist, political analyst, author, publisher, editor of Foreign Policy Journal, and he's also a writing coach. Jeremy has written extensively on vaccinations, and that's why we've invited him here this evening. Jeremy, welcome, and thanks for joining us.
Well, thanks for that introduction. Thank you for inviting me. It's nice to be here.
Well, I've admired your work. I've read many of, I'm sure I haven't read everything because you've been very prolific, but you've written some incredible pieces that are insightful, courageous, honest, well-researched, and it's a pleasure to have you tonight with us. And I just want to honor you for being the courageous warrior for truth that you are.
Thank you. I really appreciate that. It's very encouraging.
I'm wondering, just as a way of beginning, if you might kind of give us a little insight on how you fell down the rabbit hole on vaccines.
Well, it really started, when my wife became pregnant in 2012. We had our son was born, our only child. I'd always been skeptical of the claims about vaccines, and just kind of like intuitively, like I always wondered, like, well, what's wrong with just getting natural immunity and things like this? Just even as a child, I wondered, like, well, that doesn't make sense. Like, why would I do that? I can just get the infection and gain immunity. Like, it doesn't make any sense to me. So I was always kind of intuitively just skeptical of these claims that vaccines save the world and things. And so from that skepticism, I just didn't trust the CDC, didn't trust the FDA, didn't trust the New York Times and the media, and I just went to the medical literature and I started researching. And so I was expecting to find a disparity between what we're told in public, from public health officials and what was in the science, but I was shocked at just how huge the disparity is. Where what the government and the media say that science says about vaccines and what the science actually says about vaccines are two completely different things, like worlds apart. And just that huge gap between the public messaging and the science was just still to this day, as I'm researching this subject, like I'm still shocked at what I'm learning about just how great that disparity is. And so I wasn't doing this for journalism purposes. In fact, I had researched for quite a few years before I ever wrote anything about the subject of vaccines. But kind of once I had done that research and once I had kind of gained that knowledge, and I had become comfortable like reading scientific studies from doing other research, throughout my journalism career, and then also just for my own health, I had leaky gut and I didn't know what was going on with me, and so I was researching studies, just as doctors were totally unhelpful for me. And so I gained kind of a familiarity with how to read studies and just kind of got comfortable with reading, scientific papers, just doing that type of research for myself. And between that and the research I was doing for myself, for my son, I just kind of got comfortable doing that. And, but then once I had that knowledge, like I couldn't not share it with others. I had to make the decision I used to write about foreign policy. I made a decision, excuse me, earlier this year to stop publishing Foreign Policy Journal, because all of my writing now is focused on, vaccines, and then also now with the COVID-19 pandemic, the authoritarian lockdown regimes and their mass vaccination endgame. And that's just 100% of my focus now. I don't even write articles on other topics now because it's so important. And so that's kind of the journey I went in terms of how I came to write about the topic of vaccines.
You sound a little bit like Robert Kennedy Jr.'s shift that he made, where he was, deeply committed to environmental causes. And then once he fully understood the severity of the issue around vaccinations, it has now become his life's work and his primary focus. And it's a dramatic shift, isn't it? I suspect your life, at least the kind of conversations you have and the people you hang with now changed dramatically as a result of that shift.
Yeah, certainly. I mean, it's caused strife within my family. I mean, like I have my family members calling me, anti-vaxxer and conspiracy theorist and all this other nonsense, which is hurtful. But you kind of learn to, you just grow a thick skin, and it's like, well, I'm gonna keep telling the truth. I'm gonna keep writing and publishing this information. And I learned early on, when I first started, I was basically an anti-war activist. I started doing what I do basically back after 9/11 when, and I asked myself the question, why would this happen? And I wasn't satisfied with the government's answer that it's because they hate our freedoms. And so I started researching that. And by the end of 2002, I was like writing mass emails home to friends and family saying, look, there's no evidence. Of course, they were using 9/11 as a pretext for the Iraq War, and I was saying there's no evidence that Iraq has weapons of mass destruction. This is the government is lying to start a war for regime change. And of course, they were dismissing me as a conspiracy theorist and all this stuff. And I got attacked very badly for sending those emails. People just didn't want to hear, and this was just shocking to me because I was sending like credible information from like the UN inspectors and things, and the wall of denial that I met with was something that it took a really long time for me to really come to terms with, because I was sending clear information demonstrating that the government was lying, that what they're saying is not only unsupported by the evidence, but that it's contradicted by the available evidence that we have. And so it took me years to kind of understand the psychology of that, but it was a really learning experience.
What do you understand about the psychology of it? Because we've got the same dynamic now, is where people don't want to hear the information. They don't want to hear the facts.
Right. Well, what it was is, like, for example, with certain family members of mine, it was just that they had such faith, and we're all taught to believe this, that the government is good, that it's benevolent, and policymakers might make mistakes once in a while, but they only ever have good intentions. And this whole idea of American exceptionalism in foreign policy, and that applies to domestic policies as well. And it's just they have such faith in the state, in the institution of statehood, and in the government, that they couldn't come to terms, with their perception of the world and how the world works. They have that perception, and they couldn't come to terms with this information that just rattled their core beliefs to their foundation, and they weren't able to reconcile the information that I was giving them with their beliefs about the government and the nature of government. And so that's really what it was. And I like to borrow the phrase from Noam Chomsky. He describes the state religion, and he talks about how the media manufacture consent for government policies. And he also speaks of the state religion and the role of intellectuals in society, and how they're basically these priests, the high priests of the state religion. I've kind of adopted that term because I think it's such a perfect description of people's like faith in government as this benevolent force for good. Like now with these lockdowns, like we need government to tell us how to behave, because we're all too stupid to figure out for ourselves like what's in our own best interests, and how to protect our families, and how to stay healthy, and all this. And it's just like we don't own our own bodies, that like our bodies are in the possession of government bureaucrats to do with what they will, and our children are also government state possessions, that they can dictate what medical interventions our children undergo, without any consideration of the need for an individual risk benefit analysis. It's always just a one size fits all solution, whether we're talking about lockdown measures like stay at home orders, and determining what's essential or non-essential in terms of businesses, or whether it's vaccination. I mean, that this idea that we need government bureaucrats dictating to us what our decisions should be and what our choices should be, is just so frightening. That this authoritarianism is now just been advanced. So, and it's discouraging because, before the COVID-19 pandemic, I was very optimistic. I loved what I was seeing. We were winning. We were winning. And now with this, it's like it's a big setback in terms of the health freedom movement, because people are so afraid. There's so much fear, and when people are afraid, they're willing to surrender their rights and their liberty.
Yeah.
And people aren't conceiving of how dangerous that is, and they're not considering the consequences of that, in terms of just like consenting to the government assuming all of these authoritarian powers, and the potential consequences of allowing the government to say, yes, we have this authority.
So Jeremy, why, and I ask others this question as well, why did you see this, or how did you see through this when most people don't? Any idea about what made that happen or allowed that to happen?
I think, that's a really good question. And I'm not exactly sure the answer myself, but it just, back at the time, I mentioned, I got started kind of after 9/11, and I spent 12 years in Taiwan, and right after 9/11, I had bought my plane ticket to go to Taiwan like 2 weeks before 9/11 happened. And I just got there, and I kind of discovered the internet, and I was kind of outside of the US mainstream media propaganda system. And I started getting all my information from the internet. And just, I wasn't like limited to, I'm going to watch TV news, or, this is the newspaper that I have access to. It was just, I could go anywhere and read anything from any source. And so I just started trying to reconcile all the contradictory information. And I just found that I had a natural kind of skill in terms of being able to take kind of disparate pieces of information, and that oftentimes is very much contradictory, and to do kind of an assessment and analysis to be able to determine, okay, well, how do I reconcile these contradictions? How do I explain these things? And what is true, and what is uncontroversially agreed upon by all different perspectives and parties? And then where are the conflicts and the contradictions? And then how do we reconcile them? And what are the biases in the sources that I read? And how do I assess sources? And I just kind of, I was very good at that, and which is why I was able to see so early on that the government was lying about our weapons of mass destruction in Iraq. And I just kind of apply the same kind of analytic skill to every topic that I cover, whether it's economics or vaccines or the lockdowns or whatever it might be. And so but the thing is, I don't think that it's it came to me kind of naturally, but I've always been kind of skeptical also of quote unquote the system. I remember always growing up and thinking that the system, it wasn't right, that why do we accept things the way they are? And most people around me are just kind of like just accepting that as though like the government that we have is like the greatest government that could ever be, and like we can't do better than this. And I always like rejected those assumptions. It's like, well, I think we can do better than this. So I was, maybe it's part of just my character, but I think that the skills that I did learn, that I acquired, in terms of journalism and research and analysis, I think they can be learned and they can be taught. And I think this is really important, because as news consumers, we need to be able to recognize propaganda and be able to see through the lies and the deceptions and be able to do this kind of thing. And so it's not just a skill that journalists need to have, it's a skill that every single news consumer needs to have. And that's something that I try to do with my writing, is not just kind of like give people information, but to help them think things through, and to help show them the logic of things, and how to think for themselves, and to be skeptical, and don't take anything that I say, don't take my word for it, check my sources. I'm giving you the sources, go look it up. You can verify for yourself and see that what I'm saying is true. And so I think that's a really important point that I really want to emphasize, is that like we all have to have these skills. And so that's something that I'm conscientious of when I'm writing, is that I want to not just give people that information, but kind of train people how to think and how to, avoid becoming deceived by the propaganda and misinformation. And with misinformation on either side, because it's true. I mean, there's misinformation on all sides of all debates. So it can be, it can be a labyrinth type of situation where you have to find your way through it all. But, there is a way.
But I think you've nailed it. The first step is you have to acknowledge that there is misinformation out there. There is propaganda. It exists. And I think many of us have grown up naively, as you said, thinking the government is acting in our best interest. If you've got a white lab coat, you're acting in my best interests. If you're the mainstream media, you're acting in my best interests. And it's a shock to realize when you come to the realization that that's not so. There's a profound, I call it a death, because there's the foundation that we have based our belief systems on begins to crumble. And I think the good news out of that is that we have to start to grow up. We have to start to mature. We have to develop wisdom, skills of discernment. We have to become critical thinkers. And I would suggest that humanity is not very good at that. That, you know, you're an exception. And I'm always curious about why some people think critically and most don't, or why some people can see through the facade and most cannot. But you have a skill, and I really appreciate how you help people to learn how to think so that they can arrive at their own conclusion. You don't want them to simply accept your assessment of a situation.
Right. Yeah. And, you know, also another thing that I've kind of had to learn is who is reachable and who isn't. And I kind of learned that, you know, I was going back to, again, you know, with the confrontations I had about the Iraq War when I was just getting started, and I wasn't even like publishing anything yet. I was just sending emails home to people, and I was really distressed by that. And you know, again, I didn't understand it at the time. I didn't understand the psychology of it. And one of the authors that I had been reading at the time was William Bloom, who wrote the book Rogue State and also Killing Hope, about, you know, criticisms of U.S. foreign policy. And I emailed him, and he was kind enough to email me back. And I asked him the question. I was like, you know, I explained to him like the frustration I was having, and I said, you know, how do you reach people? And he said, you know, he said something I'll never forget. He said that, you know, there are some people who will believe whatever the government says until the government knocks down their door and steals their firstborn child. You have to leave those people alone and just move on to the people who are willing to listen and have an open mind and are reachable. And so it's, because I was just, and still to this day, I'm unreasonably optimistic that I can get through to people all the time. But, you know, that's just not the case. And I have had to learn to kind of, you know, recognize people that are open-minded enough to be able to kind of communicate with about things that are controversial, and the types of people who, no matter what you say, no matter what kind of facts you give them, they're just going to go on believing what they believe, and facts don't matter. And so we also have to kind of be able to recognize those different personalities and character traits, and you know, don't waste our time with people who are never going to change their beliefs no matter what.
Well,
move on to the people who listen. Yeah,
I think that's an important skill set for us all to figure out, because we don't want to just preach to the choir. Those people are already engaged. Right. And I would agree with you. There is a significant portion of the population that can't hear us, no matter how we say it, no matter what we say, that we've already been discounted, and there's no room in their cup for new or different information. And so we're looking for people that there's some curiosity, there's a crack there, there's an openness, there's a possibility. And are there things that you've learned about how do you open that space so that somebody can hear you potentially?
Well, it's, you know, it's always good to just start by trying to establish common ground. Like, you know, what do we agree on? Like, what points can we agree on that, you know, that's not controversial? And I think that's a good starting point. And, you know, for example, with the vaccines, you might ask somebody, well, do you believe that you have a right to informed consent? You know, kind of, and most people I think would say, well, yeah, I mean, of course, right to informed consent. It's right.
Except if it's a COVID vaccine.
Right. But then, yeah, but then you put it in some other context, and suddenly it's like, oh, well, no, people don't have that right. The government has the right to dictate to you what goes into your bodies. And so, you know, you kind of, you're able to kind of identify the cognitive dissonance that's holding them back from seeing the reality. You know, that they have contradictory beliefs. They believe one thing, and at the same time they believe something that's totally contradictory, and in their minds, you know, that there's no contradiction between these two things. And so if you can kind of just help them see that both things can't be true, that it's not logically possible. It's not logically possible for both things to be true at the same time. So if you can kind of identify those areas of like cognitive dissonance and or just mistaken beliefs, you know, people to believe, you know, for example, one of the arguments I had with a loved one was, you know, I was accused of spreading misinformation because I had shared a post on Facebook, you know, saying that, well, there's mercury in some flu shots, and of course, mercury is a known neurotoxin, and he was arguing with that, saying, "Well, no, mercury in vaccines is safe, and look at this information here from the CDC." It's just like, of course, the CDC. You look at their own sources on the page where it talks about vaccines. The mercury in vaccines is, unlike the methyl mercury in fish, is non-toxic and readily eliminated from the body. And you go to the CDC's own sources, and they say that the mercury is a known neurotoxin that, quote unquote, accumulates in the brain, and in fact accumulates more readily in the brain than methyl mercury does. So, if you can just kind of like show people, like demonstrate to them that certain information is false, and it's not just like, well, the CDC has authority and therefore we're going to believe them. It's like, well, set aside authority and just look at the facts. I mean, look at the CDC's own sources, and if you can do that with people and just kind of, although in this case it failed because the person I was having this discussion with was just wouldn't even look at the, and I said study after study after study of the harms of mercury and ethyl mercury, and the damage that it does. But it was just like he was talking to a brick wall in that case.
Well,
and that was an example of somebody I couldn't reach.
Yeah, and that's what I've learned is that with people that are afraid, facts don't matter. Fear trumps facts every time.
Well, yeah, and that's the thing. He was afraid because, I mean, and I can understand, what must have been going through his head, because he couldn't accept that because he vaccinated his kids.
Right.
And so he couldn't accept what I was saying is true. Like, that there's things in vaccines that are harmful. It's
too hard to go that path.
It's too hard
to think that I might have contributed to the harming of my own child.
Well, and doctors too. I mean, doctors have that kind of, there's that confirmation bias among doctors. Is no doctor any more than any parent wants to think that, well, I advise these parents to do this, and this harmed these children, and I'm responsible for that. They were doing what I recommended, and this caused harm. I mean, what doctor wants to come to that conclusion? Of course, there's this confirmation bias. People tend to believe, if people have a pre-existing belief and they accept information that supports that belief, and they just reject anything that contradicts that belief. And this is really important. Also, in terms of being news consumers, and not just for journalists, but we all have to set aside our confirmation biases. And that's a tricky thing to do. But there's there are ways of doing that, and just setting aside, being willing to accept that you might be wrong about things, and that your beliefs might be fundamentally incorrect. And I think we all have to be willing to be open to that possibility, and this strengthens us. I'm always over the years, debates I've had, whether it's on social media or via email or whatever it might be, has always strengthened me. I think strengthened my writing and strengthened my arguments, because it helps me. I like to know, as a journalist, I like to know what the opposing arguments are. And you have to me, it's like Sun Tzu's Art of War. I mean, know thine enemy. When we're up against these forces, the government and the media and the propaganda system, and that's one of the things I do in my writings. I'm always trying to anticipate what the possible objections might be. So before I won't even give people who might argue against what I'm saying, I won't even give them the opportunity to make their arguments, because I'm already anticipating them and preempting them in my article, so that I'm basically disarming them. And that's something that I consciously do with my work. And I think it's really important is to not ignore the other side's arguments, but to, I'm always, a lot of people just go to the news sources that kind of share their perspective, but I tend to read more. I mean, the newspaper that I read the most is the New York Times. And so I'm not going to sources that just support my points of view. I have to go to all kinds of other sources that are presenting points of view and information that are completely different from my own points of view. And I think that's what we all need to do. We all need to learn how to go to different sources and not, fall into that confirmation bias.
Good thoughts.
Yeah.
Let's talk a little bit about COVID. So I'm sure you've said it's become a major focus for your work now. What's your assessment of the situation we're up against here?
Well, the situation is that there's so much fear mongering. I mean, I don't want to downplay the seriousness of the disease. It's a serious disease, and it can be potentially deadly. But if we look at the scientific data, for people under 50, the risk is especially if you're healthy is quite negligible. Even the CDC's quote unquote best estimate of the infection fatality rate for people under 50 is, I think, is 0.05%. For children, it's 0.003%, according to the CDC, and that's an overestimate. Those are overestimates, by the way, because they're basing those estimates on serological studies, so studies that are using antibody tests to look for antibodies. But we know from other studies that a lot of people who become infected acquire immunity, and then their antibodies wane, which doesn't mean that they lose their immunity, but the antibody titers fall below detectable levels. And so, just because people are getting these false getting a negative test with these serological assays doesn't mean that they weren't infected. And so these studies underestimate the true infection rate. And so if you have, there's a downward bias in the, it biases the denominator in that calculation downward, which of course biases the calculated infection fatality rate upward. And so, but you compare that to flu. So, we're all told that flu is 0.1% infection fatality rate, which we can argue about, but that's what we're told, right? That's what the media constantly tells us. That's what the CDC says. So here you have a situation for most people, COVID-19, the infection with SARS-CoV-2 is less dangerous than we're told is the risk from the flu. And of course, in elderly people, especially people with comorbidities, it's much, much higher. It's 5.4% according to the CDC's infection fatality rate, if my memory serves. So it is quite alarmingly high. But at the same time, the CDC also has presented data where, 6%, only 6% of people who are, being COVID-19 related deaths, let's call them, where they're being, the deaths are being attributed to COVID-19. Only 6% of deaths are in people who had no identified underlying medical conditions. So 94% of people who die from COVID-19 have other underlying medical conditions, and on average 2.6 other, chronic diseases that were a contributing factor in the deaths. And so it's not, we all have to understand there's a difference between infection and disease, and there's a difference. And just because you're infected doesn't mean you have the disease. And that's a really important thing. And this gets into the PCR testing. And there's institutionalized scientific fraud happening that's being used to justify the lockdown measures, which is the use of PCR tests to diagnose COVID-19 in the absence of any clinical diagnosis, any clinical symptoms of illness. So these people are getting, a positive test, and they're being counted as COVID-19 bases, even if they don't have disease, which is, of course, nonsensical. And yet this is what's happening. And they're using these case numbers to justify these lockdown measures and just, instill all this fear into people. And it's the fear mongering that people are willing to surrender. As I mentioned earlier, they're willing to surrender their rights and their liberty if they're afraid and they think that they need the government to protect them. And of course, the government has turned us all on each other because we're all supposed to be afraid of each other. When you go to the grocery store, watch out for that person walking next to you in the supermarket aisle because they could be breathing and their breath could contain aerosolized virus, and walking past them, they could get you infected if they're not wearing a mask, and all this ridiculous nonsense that's completely unsupported by the scientific evidence that which of course is clarified that the scientific evidence is that number one is primarily droplet transmission, not aerosols, and airborne transmission does appear to have occurred in some cases, but it's unique circumstances where it's an enclosed space with poor ventilation and there's a crowd of people indoors in this space, in which case the aerosols can build up possibly to deliver an infectious dose, but it appears to be quite rare and fairly insignificant. And so it's primarily droplet transmission. And of course, this is the basis for the CDC's, 6 foot social distancing, which makes sense. Because close contact is a key determinant of transmission risk. And so, the idea, and by the way, close contact by the CDC is defined as being within 6 feet of somebody for 15 minutes or more. So the idea that you're going to pass somebody in a supermarket aisle and get sick from them or give them illness unbeknownst to you, it's just the fear that people have is just irrational, and this irrational fear is driving these the consent, for these measures. And so that is to my assessment of the situation, is that the lockdown measures, number one, they're of questionable benefit, highly questionable benefit. Number two, they cause massive harm. This is unquestionable. There's no doubt about this. There's no debate about this. They cause massive harm, not just economic harm, not just economic harm, but not just measured in terms of dollars, but in terms of health and lives. And I'm talking excess deaths, in estimates of hundreds of millions of excess deaths. Look at the UN, just like 130,000, I think, was their estimate of excess deaths just from excess infant mortality as a result of global lockdowns. And that's just one statistic. And it's very easy, especially if you look at quality adjusted years of life lost. It's very easy to say that that's causing far more harm than the lockdowns could ever, any benefit that lockdowns could ever provide. Even by the lockdown, even by the best data, suggesting that the lockdowns have benefits, even if we accept those arguments, it's very easy to see that they're doing far more harm than good. Because, again, most people who die are already, they're over 80 years old, right? And they have comorbidities. They're already beyond the age of expected life expectancy. And so, it's always a tragedy. Every death is a tragedy. But, look at, again, the death of a child in terms of years of life lost is far more tragic than the death of an 85-year-old person who's probably going to die very soon anyways, because they're very sick and have some chronic illness. And so
Jeremy, I agree with you. To me, I think it is abundantly clear, the evidence is there, that can't be disputed, that the lockdown measures are causing more harm than good. And yet they're persisting, and it's persisting globally. So how do you make sense of that? What's your assessment of that?
Yeah, well, it's the media. I mean, the media are, on one hand, you have the governments making claims about, of course, cherry picking data from the medical literature to support their claims. An example of that off the top of my head is the CDC very recently put out a document talking about the benefits of masks, and they cite a study that that claimed to have found an association between masks and reduced transmission, or I think it was lower transmission. But that same study cited by the CDC also found that there was no association between lockdowns and reduced transmission. But of course, the CDC didn't report that part of the study. So they just cherry pick whatever they want that supports these public health measures. And they ignore all the data and all the science and all the information that contradicts it. And they pretend it doesn't exist. And of course, the media are totally complicit in this deception. They pretend that, it's just, and a really good example of this is the absurdity surrounding the Great Barrington Declaration. I'm assuming a lot of people here have probably heard of the Great Barrington Declaration, which was a declaration by a number of well-respected, world-renowned scientists, including Sunetra Gupta from Oxford University, who was one of the preeminent epidemiologists in the world, recognized as such. And it is on this document saying that these lockdown measures are causing more harm than good, and we can't just, we have to consider the costs as well as any potential benefits of these things. And they're also delaying and prolonging the epidemic and the pandemic, because people who are young and healthy, who otherwise would be out being exposed and developing immunity and building the population immunity that would then be the protection that is required to protect elderly people at high risk. And so we're undermining the goal of herd immunity by implementing these measures. And the response to this from other scientists as well as the media was that, this is a bunch of nonsense, and this idea that can gain population immunity is just dangerous nonsense. And it's like, this is basic epidemiology. In fact, it's so basic that it's in their own models. Like if you look at the Imperial College London model that was used in back in March, that was the justification for these policies. It's right in there that by implementing these policies, we're going to be prolonging the pain, delaying the inevitable, because of the prevention of the development of population immunity. It's right in there in that Neil Ferguson paper. And yet now we're supposed to believe that this idea that that there's population immunity, that natural herd immunity, scientific is nonsense and pseudoscience. I mean, the self-contradiction. There's so much hypocrisy from these so-called scientists who, and I use that word, just like there's so-called journalists out there, but they're not doing journalism. And these scientists aren't doing science. They're propagandists masquerading as professionals. That's what they are. At least in certain areas, like such as this. And they may do great science in other aspects, but in terms of like advocating policies and in journalism, that's another thing. There's very little journalism in the mainstream media. Right. There's some great journalism, but it's kind of rare. You see like a really good piece of great journalism in the media. It's just like a never-ending stream of garbage, and they're not doing journalism. They're doing public policy advocacy, and this needs to change. And I think there's an opportunity for independent journalism to really kind of overturn that whole business model of mainstream media. And it is a challenge. And this is the thing. The mainstream media see that, I think, because this is exactly why they're censoring us.
Right.
And because they want to be like, we are the arbiters of truth. You must trust us as your sources. Don't go to those alternative websites for information. Don't go to your Facebook feed or your Twitter feed for information. You come to us because we are the arbiters of the truth. And that's what it's all about. Which explains why, they have such an inconsistent fact-checking process. I mean, so they fact-check information, if it's contrary to the political agenda that's being pushed, but if it's misinformation that comes from the advocates of these political agendas, that's fine. It's fine for them to have misinformation. And the article I was just working on just before this meeting, actually published one this morning, and I was working on another one throughout this afternoon, and it's on this specific topic. So I'll give you a specific example of a fact check that criticized certain news sources and Facebook posts for mistaking the term asymptomatic as meaning without symptoms, but there's a distinction between a technical distinction in the literature between asymptomatic, which means people who never develop symptoms. In other words, people who never get COVID-19, but they're infected, but they never develop the disease, and pre-symptomatic individuals, who are people who might transmit the virus before they develop symptoms. And so they're using this distinction to say, well, these things are false, but at the same time, they will never fact check. For example, when the CDC just last week or this week put out a document saying that 50% of transmission is from asymptomatic individuals. That is false. That is a lie, and it is a deliberate lie. That is not true. And it's just for the same reason, because what they're talking about is not just asymptomatic transmission, which, by the way, the scientific evidence suggests is very rare, and that's the words of the World Health Organization, and that's correct. That asymptomatic transmission appears to be very rare, and we have to distinguish that from asymptomatic transmission. So when the word is, in other words, when the word is used to support this fear mongering that there's all these silent carriers out there, and so again, when you're passing by people in the supermarket, if they're not wearing a mask, watch out, you can get sick from them. There's all these silent spreaders out there. So it's fine to use the term improperly if that's the end result of it, is to instill fear into people. That's fine. But if you use the term, to suggest that people without symptoms never spread the virus or rarely spread the virus, then that's misinformation. So it's clear. The double standard and the hypocrisy is just so.
Well, you and I talked about this today. Is that in our movement we have to be incredibly vigilant to make sure that we don't have one misstep. We have to reference everything we say. We have to be careful with not overstepping a position, and yet the other side seems to be able to operate with complete disregard of the facts, of truth, of any of that. But I want to get into, so what's the bigger agenda here? Do you see that there's a bigger agenda? Is that something you spend time looking at, or?
Yeah, and I'll address, when speaking on the topic of misinformation on our side, there's a lot of people who believe that for example, the virus was deliberately engineered specifically to create this pretext to usher in, this New World Order agenda, the whatever authoritarian agenda. And, I wouldn't rule out the possibility, but that is, truly a conspiracy theory. And I just don't like to go there. It's not necessary. And, by the way, that it's quite possible that, the idea that there is that the virus does have a lab origin is a legitimate scientific hypothesis. That's not a conspiracy theory, no matter what the mainstream media tell you. So, this is quite possible. I think it's more likely that, assuming that it was whether it was engineered in a lab or whether it was it evolved naturally. I think we have to I don't like to go there in my writings. It's like, let's just deal with the facts, because like you said, if any little misstep is just going to be jumped on. And so I don't see any kind of like grand conspiracy, but at the same time, there's certainly people, very, very powerful people and influential people and institutions that are using this pandemic to push through political agendas that pre-existed the pandemic. Certainly, there's no question about that. And Bill Gates is one of them. And so, that's certainly true. And so, I would think we have to really be really careful about, how we go about that. And so, yeah, I think in that sense, absolutely, there is an agenda here. And in fact, you look at, and it's an authoritarian agenda, and it's right out in the open. There's no secret about this at all. You look at the stated, declared end game, the exit strategy of the lockdown measures is mass vaccination. So that's one of the agendas that's being pushed. And again, that's right in the Imperial College paper back in March. That was what they said, that we have to maintain these lockdown measures on and off. Like you can turn the economy off, like, on and off like a light switch, which is absurd. But that was what they proposed. Total economic ignorance. And they said right in their paper, we're not considering the costs of these policies that we're advocating. How can you advocate a policy without considering the costs of the policy? This is the kind of people we're dealing with. But the point being that, they were explicit right in there that this is the end game. This is the exit strategy of the lockdown. And at the same time, acknowledging that the lockdown measures were preventing natural herd immunity from developing. And so yeah, absolutely. But there is grander agendas being pushed. And I think this is what helps to explain, the deception and the lies coming from the government. Because there are people in government, and the institution of government itself always tends to want more power and more authority over people. People who work in government tend to be people who like to exercise authority and power over people and control other people. And so it's just this natural tendency for this to happen. And so I don't see a conspiracy in it necessarily, but it's certainly happening. But it's just right out in the open, and it's just a natural. It's the nature of government for this to happen.
Well, it seems well coordinated. If it's not a conspiracy, in the sense that people come together and conspire to a certain agenda, there certainly is a high level of coordination, I would suggest.
Yeah, well, sir, I take it back in that sense of the word. Yeah, but it does fit the definition of conspiracy, dictionary definition. Yeah, that people are conspiring, and the fact checking. The media are literally conspiring together to stop people from being able to get information from other sources. That's a conspiracy. So yeah, in that sense, absolutely, there's lots of conspiring happening. Yeah.
So I want to take a few minutes just to talk about how this is for you personally, because what you talked about is what you and I shared earlier today. This is a hard path that you're on. You've taken on to be a warrior of truth that most people, I would suggest, don't want to hear. How do you sustain yourself in that? How do you not allow that resistance or just simply disrespect? Because I think we get a lot of that. How do you sustain yourself?
You mean psychologically, in terms of just the fact that
emotionally, spiritually, physically, this is a war, right? I think there's no discount that this is a war, and we're on the side that is we're outgunned in many ways by the level of organization, by the finances, by the control of the mainstream media, and yet we have to persist. And I think everybody on this call here, is looking for ways to sustain themselves in this battle, because we have to. We don't have a choice to stop. And yet it's grueling.
It is. It's grueling, and it's a challenge, and it's very stressful. I mean, it's not easy to spend all day reading about all these horrible things, and it really takes a toll. um, but it's just it's not what I want to be doing. I'll put it this way: it's not what I want to be doing. I'd much rather be doing other things with my life and with my time. But it's a duty, it's a responsibility, and I guess the thing that really keeps me most motivated. I mean, and before my son was born, I was doing this, but I think the thing that really motivates me now, more than anything, is my son. And I just think, what kind of world do I want him to grow up in? And so that's the driving force for me. And so as long as I keep that in mind, as long as I keep that at the forefront of just remembering, like, why are we doing this? This is why we're doing this. It's for our children. It's for future generations. And it's not. So it's for myself. There's a selfish motive as well, because I enjoy my liberty. I would like to be able to have prosperity without, wealth being stolen from me and things like this. But it's really just finding that thing that, what is it about life that makes life worthwhile, and just keeping that in the forefront of my mind, and also just taking time to step away sometimes. Just like, whether it's, I need to set aside my work and go play with my son for a bit, or like every Sunday, for example, I have a rule is, I promise my son no work. I'm not going to do any work on Sundays. We're just going to spend time together, and that's really important to me. That's precious time for me, and it's rejuvenating. And just going for walks with my wife and my son out in the woods, and just being out in nature is really refreshing and rejuvenating for me. And just just there's things that I do that just to kind of de-stress and to get my mind off of these things for a while, so that when I come back to it, I can just kind of come back fresh and rejuvenated and motivated. And that's the key for me, I think, is just recognizing when I'm being overwhelmed, and in knowing when it's time for me to just take a step and put the work down for a bit, and just go and kind of de-stress. And that's so I just kind of have developed these systems and methods of doing that, and I have to. I mean, I wouldn't be able to continue if I didn't.
Well, this is a marathon, and what I keep saying is it's not a sprint; it's a marathon. We have to learn how to pace ourselves.
Yeah.
And would you say that ultimately you have a sense of hope, or you can hold on to hope that we can move through this, or how do you envision our journey through this?
Yeah, I am optimistic. I mean, I mentioned earlier, the pessimism of how I felt like we were really on top of things and really winning the fight in terms of the war for health freedom prior to the pandemic. And then the pandemic hit, and suddenly there's this authoritarian regime. Excuse me. But that's not to say that I am pessimistic. I am still optimistic, because I do see so many people not fooled by the propaganda, and they're awake, and they're aware, and they're fighting it, and they're speaking out. Whether it's the barber shop owner who refuses to close down here in Michigan, and the government tried to take him to court, and he won the case after the Supreme Court here in Michigan ruled that Governor Whitmer's executive orders were unconstitutional, because she doesn't have the authority to make law. That's the duty of the legislature, and the legislator, and they ruled that a law supposedly giving her that power was unconstitutional, because the legislature has no authority to delegate its powers to the executive branch. This is a violation of the separation of powers that the whole Constitution is based on. So, whenever I see stories like that, of like people just standing up for their rights and their livelihoods, it's always inspirational, and there's more and more cases like that happening, and I think people are just getting fed up, and they just want it. They want to be able to live their lives and make their own choices, and assess their own risk, and make their own judgments about the risk. And the idea that government bureaucrats are somehow in a better position and have more knowledge to be able to do that for everyone is ludicrous. I mean, it's the same with vaccines. The idea that government bureaucrats are able to do a one-size-fits-all risk-benefit analysis, foregoing the need for an individual risk-benefit analysis, is completely unscientific, for one, and logically absurd. There's a need for individual, because there's no government bureaucrat as the requisite knowledge of the individual and the individual circumstances to be able to do a risk benefit, a meaningful, reasonable risk benefit analysis. And this is true for vaccines. It's true for, business closures. It's true for stay-at-home orders. It's true for mask wearing. Government, they're not omniscient. It's almost like there's this belief, that legislators and policymakers have this superhuman, abilities to be able to like make these types of decisions on behalf of everyone indiscriminately. I mean, it's if you think about it logically, it's so ludicrous, and yet people just accept this ludicrousness and surrender. But I am optimistic that we are going to overcome, and I do think that the future will be brighter. I mean, there's always going to be threats on the horizon, or imminent threats or existential threats to our freedom, but I think all in all, things will continue to get better for humanity, and so I am optimistic. I look around and I see more reasons for optimism than pessimism, I think, despite everything that's happening right now.
Well, I think that's a good place for us to end it. This has been a rich conversation that I very much enjoyed, Jeremy. And I just want to thank you for your work. And you're one of those few investigative journalists who, in my view, really does their homework. And what I like is what you said, is that you really help people to think critically so that they can understand and make their own decisions, not simply assign it from somebody else to you. And I think that's incredibly important work for our development of wisdom as a species. So your work is really important.
Thank you. I really appreciate that.
Now, I know that your work is supported by donations, and so I just want to encourage all of our Vaccine Choice Canada members to honor Jeremy for his work. And if you go to his website, jeremyhammond.com.
JeremyRHammond.com, yes.
Oh, is it R. Hammond? Yeah.
I use my middle initial, yeah.
Right. I can see that I left that out. That's an important distinction. There's a spot to make a donation, and we need to make sure that you can continue to do this work.
Thank you very much.
Thanks for joining us tonight.
You bet.